Tonight, if you get a fever, a deep cut, a broken bone, or a pain that feels wrong, you know what to do. You call a doctor, you go to a clinic, you visit a hospital. There are bright lights, clean beds, trained nurses, machines that beep, medicines with strange names, and people whose entire job is to keep you alive. It feels normal, almost ordinary. But for most of human history, this safety net did not exist. There were no emergency rooms, no ambulances, no antibiotics, no x-rays, no clean operating theaters, no pain-free surgery, no doctors waiting behind glass doors at 3 in the morning. If you got seriously sick, your family did not rush you to a hospital. They watched, they guessed, they prayed. They tried herbs, heat, cold water, strange mixtures, old advice, lucky objects, and sometimes ideas that made the problem worse. And the scariest part was this: most people did not know what was actually happening inside the body. A fever could be a mystery. A wound could become deadly. A cough could spread through a whole house. A simple infection could turn into a nightmare. Today, getting sick is still frightening, but before hospitals, getting sick was terrifying. To understand why, we have to go back to a world where the human body was one of the biggest mysteries on Earth. Long before cities, long before written medicine, long before doctors wore white coats, humans lived in small groups. They hunted, they gathered plants, they slept near fires, they followed animals, they crossed rivers, they survived cold nights, sharp rocks, insects, hunger, and predators. In that world, sickness was not just uncomfortable, it was dangerous because everyone depended on the body to work. If your leg hurt, you could not follow the group. If your stomach became weak, you could not hunt or gather food. If a child developed a fever, nobody had a thermometer, no medicine cabinet, no hospital bed, and no clear explanation. Early humans probably learned medicine the same way they learned many things, by watching, trying, and remembering. If a certain leaf helped a stomach pain, people remembered it. If smoke kept insects away, they remembered it. If a wound healed better when covered, they remembered it. If dirty water made people sick, they may not have understood germs, but they could still notice patterns. This was the beginning of healing. Not science yet, not hospitals, just survival memory. Imagine a small prehistoric group sitting around a fire. One person has a deep cut from a stone tool. Another has a swollen ankle. A child has a fever. The group looks worried. There is no doctor. There is only the oldest person in the group, someone who has seen many injuries before. They clean the wound with water if they have clean water. They press leaves on it. They wrap it with animal skin or plant fiber. They wait. And waiting was a huge part of ancient medicine, because sometimes the body healed itself, and sometimes it did not. That uncertainty made sickness terrifying. But then humans changed their lives in a huge way. They stopped moving constantly. They began farming. They built villages. Villages became towns. Towns became cities. And cities created a new problem. People were now living close together, very close. They shared water, they shared streets, they shared animals, they shared insects, they shared smoke from fires, they shared waste. And without knowing it, they also shared disease. A cough that once stayed inside a small group could now move from house to house. Dirty water could make a whole neighborhood sick. Rats, fleas, lice, mosquitoes, and flies became silent travelers of disease. Food could rot in crowded markets. Waste could leak into drinking water. And because people did not understand germs, they blamed the things they could see or imagine. Bad smells, evil spirits, angry gods, curses, unbalanced forces, poison air. The body, to them, was not a machine with organs, cells, blood vessels, bacteria, and immune systems. It was a mystery box. When something went wrong inside that box, humans tried to explain it using the world they understood. In ancient Mesopotamia, illness could be connected to gods, demons, or spiritual forces. In ancient Egypt, healing mixed practical treatments with magical spells. Egyptian healers could treat wounds, bandage injuries, and use plant-based remedies, but they also believed invisible forces could cause disease. In ancient Greece, medicine slowly moved toward more natural explanations. One famous idea was that the body contained 4 fluids, often called humors: blood, phlegm, yellow bile, and black bile. Many doctors believed sickness happened when these humors became unbalanced. This idea would influence medicine for a very long time. Too long. Because when people believe sickness is caused by imbalance of fluids, they may try to remove fluid from the body. And this is where one of history's most famous medical treatments enters the story: bloodletting. For centuries, many healers believed that removing blood could help cure illness. A patient had a fever? Remove some blood. A headache? Remove some blood. Weakness? Strangely, remove some blood. To modern ears, this sounds shocking. If someone is already weak, taking away blood usually does not help. But for a long time, people believed it made sense. And that is one of the scariest parts of medicine before hospitals. People were not always careless. Many were trying hard to help, but they were working with wrong ideas. And when your map is wrong, even a confident guide can lead you into danger. Now, imagine getting sick in an ancient city. You do not go to a hospital like today. You might visit a healer, or a priest, or a temple, or a person in the market known for making remedies. Maybe your mother knows a plant mixture. Maybe your neighbor recommends a charm. Maybe a traveling healer says he can cure you with a special powder. Maybe someone says the problem is in your blood. Maybe someone else says the problem is in the air. And the terrifying part is that nobody can prove who is right. There are no lab tests, no microscopes, no blood reports, no scans, no oxygen monitors, no heart monitors, no clear diagnosis. Just symptoms: a hot forehead, a weak body, a strange pain, a wound that smells bad, a cough that will not stop, a child who cannot keep food down. The family watches the patient, and every hour feels like a question. Will they improve, or will they disappear? But humans did create early places of healing. In many ancient societies, temples became centers where the sick came for help. In ancient Greece, people visited healing temples connected with Asclepius, a god of medicine. Patients might sleep in the temple and hope for healing dreams. Priests and attendants might give advice, baths, exercises, diets, or treatments. In ancient India, ancient medical traditions developed ideas about surgery, herbs, diet, and body systems. In the Islamic Golden Age, hospitals became far more organized, with trained physicians, wards, pharmacies, and teaching. In medieval Europe, monasteries often cared for the sick, travelers, and poor people. So, yes, healing places existed, but they were not hospitals in the modern sense. They usually did not have advanced surgery, laboratory testing, sterile instruments, antibiotics, anesthesia, X-rays, or modern nursing systems. For most ordinary people, especially in villages or poor city areas, sickness was still mostly handled at home. And home care could be loving, but it was limited. Picture a small wooden house in a medieval town. Smoke from a fire fills the room. Animals may live nearby. The floor may be dirt or rough wood. Water comes from a well or river. Nobody washes hands with germ theory in mind, because germ theory does not exist yet. A family member lies under blankets with a fever. Someone brings broth, someone brings herbs, someone opens the window because they believe bad air must leave. Someone else says the window will make the illness worse. The patient sweats. The room smells of smoke, herbs, and fear. And outside, the street is not clean. Waste, mud, animals, and rotten food may all be close by. This was not because people were stupid. They were living before the invisible world became visible. Before microscopes revealed tiny life. Before scientists understood bacteria and viruses. Before doctors understood how infections spread. Before hospitals became places designed around cleanliness. The invisible enemy was everywhere. On hands, on tools, in water, on cloth, in wounds, in crowded rooms. But nobody could see it. and when you cannot see the enemy, you fight shadows. One of the greatest dangers before modern hospitals was childbirth. Today, childbirth can still be serious, but trained medical teams, sterile tools, blood transfusions, surgery, antibiotics, and emergency care can save many lives. In the past, birth often happened at home. A midwife might help. Family women might gather. There could be experience, courage, and care. But if something went wrong, options were limited. Heavy bleeding, infection, obstructed labor, or a baby in distress could become life-threatening quickly. There was no ambulance waiting outside, no operating room down the hall, no modern blood bank, no fetal monitor, no safe emergency C-section as we know it today. For families, childbirth was not only joyful, it was frightening. Every new life arrived beside danger. Another danger was surgery. Before modern anesthesia, surgery was something people feared deeply. Imagine needing an operation before pain control. The surgeon must work fast, very fast, because the patient is awake, terrified, and in extreme pain. There are no modern monitors, no safe anesthesia team, no sterile operating room, no antibiotics if infection starts afterward. The best surgeons were often praised for speed, not because speed was